Dr. Deuk. I'm here with one of my patients who actually underwent a thoracic laminectomy yesterday at the surgery center at Deuk Spine, and he went home the same day.
Oh yeah.
Yeah, just a few hours after surgery.
Yep.
Now, I've operated on you before. I did a fusion because you had a work injury. We went up to T11.
Yeah.
And then above the fusion, he developed what's called adjacent segment disease, where he developed stenosis or narrowing from ligaments that were thick and inflamed, pushing on the spinal cord. You started to get worse after the surgery, and it progressed until your legs were getting weak.
Yeah, it started, walking started becoming an issue, and driving my car with a clutch was really becoming an issue.
Clutch driver, wow, you don't hear a lot of clutch drivers.
Well, and Shelby's only come that way.
That's right, that's true, that's true, nice.
Yeah.
So we did your surgery yesterday, and how are you feeling today?
I feel pretty good. My back, it seems like my shoulders are a little sore, but I'm sure you probably had me something.
Yeah, filleted open?
Yeah, so, but they're a little tender, and but that's about it, you know. Feels, like I said, I'm feeling like a tingling, like when you're asleep on your arm and
Yeah,
it goes
like
dead.
your nerves are waking up.
Yeah, something's happening. You know, I still got the numbness and twinkling, whatever. But I mean, it's different. It's different than what was there.
Yeah.
You know,
So you
the
started
pins
to
and
feel
needles.
more,
Yeah,
starting to
the
feel
pins and needles is what was there, and then now I'm feeling this tingling sensation.
Yep, nerves are waking up. Now your strength also is better today,
Yeah,
right?
yes.
Before the surgery.
Yeah. Mm-hmm.
All right, very good. Well, that's all I have for you. Anything else you want to say to the folks out there?
Hey, Dr. Deuk's a good man, good doctor. I appreciate all he's done for me.
Well, thank you. Appreciate it. Thanks for trusting us.
Thank you all.